Hey y'all, wait, welcome back to my channel, Jersey Nurse to Be. Um, I'll be talking about my 6 month update as an LPN. What else? And whatever else comes to mind, because as you guys can see, I don't edit my videos. I just record myself, and if I mess up, I mess up. And some of my videos, my words, just putting them together don't make sense sometimes. So yeah, anyways, bear with me like I say every month. So what's been happening? I think I talked about this the last video that I had, that we had a shortage of aides and we were using agency aides and agency nurses. And so for the past couple weeks, I've been seeing a huge change, and the job has been employed, and hiring more aides. So I haven't seen that much of shortage of aides in my facility. However, I still, experience having agency nurses as well as aides sometimes, and so far they've been good. Um, they've been pretty easy to work with and even manage sometimes with aides and stuff like that, because you put an agency aide on the floor who doesn't really know where all their supplies are and how everything is run. Sometimes you as a nurse have to like basically give them an orientation and stuff like that. But so far that hasn't gotten in between my workflow and stuff, and I've been succeeding in what I'm doing and stuff, and I've been learning things every day. So yeah, one of the things I wanted to talk to you guys about is that I got an IV certification through my job. Basically, what it means is that I went for an IV class. It was paid through my job. Usually, these classes run from $300 to $600 and stuff, and the job pays for it and stuff. Especially if you've been with this job for a couple months or probably a couple years, whatever how it goes. I didn't have to sign a contract through my job. With some jobs, I know from what I've heard is that if you do an IV certification with them, you have to sign something stating that you will at least give them a year of employment, basically for them to. It's like, oh, well, I paid for you to go to do this class. What am I going to get in return? A lot of jobs are like that. Thank God my job didn't ask for that and stuff. They know that I was there for 6 months, and they said, hey, let's get you IV certified and stuff. So it was a pretty good class. It was 7.5 hours long. I did come to work for that. I was in the facility, took the class, and then throughout at the end of the day, we got a little certification, but we are not um, certified until we stick at least 3 people have 3 successful sticks of IVs. So, and then somebody has to sign off on it. So it can be your nurse supervisor, or it can be another nurse who knows how to do IVs. She can sign off on it if you have had a successful stick of an IV and stuff like that. So, anyways, besides that, I haven't yet had 3 sticks because I just got my IV certification 2 weeks ago. And you guys know that I work in a floor that is all about behaviors and stuff. So, a lot of my patients are stable. They're basically on the same medications. Nothing really changes with them and stuff unless they get a sickness like a cold and stuff like that. Then that's a different story, or dehydration. If so, then of course we're throwing an IV. But nothing major has happened yet for me to do that, to get to that extent. Thank God. So there's not a lot of changes on my floor. So I don't see a lot. I don't see IVs at all on my floor. So my job decided to put me on their rehab unit, which is also called the subacute unit, and they wanted to see how I would do. And I remember my ADON texted me and she said, "Hey, how about you? How about what do you think about working in the subacute floor for one day to test it out?" And I said, "Yeah, I'm down for it. I'm up." I said, "I'm up for the challenge." And she said, "Okay, I want to see how you do." So our subacute floor at that time, which was last Saturday, we had a total of 15 patients. We should have 2 nurses on the floor and 1 charge nurse. And so one nurse does the treatments and puts up the IVs, and the other nurse does the medications. And the one who does the treatments documents as well. That's how they do it at my facility. Of course, we have a charge nurse, but on that weekend we didn't. So it was just me and another nurse. So I told her, I'll do all the medications. I put up all the IVs, and you do the documentations as well as the treatments and stuff. And we worked well with each other. Like, she did all the treatment, she did all the documentation. I took care of everything, like I said, the medications and the IVs. So yes, I was able to put up IVs, but everybody who I was putting up IVs on, they already had an IV site, meaning there was an IV there. All I was doing was connecting the medication and to the IV site. So they had a pick line or a midline and stuff like that. So I was able to do that. I had 5 patients on IVs. I had 2 that were on IVs in the morning and 3 that were on the afternoon. So I was able to flush IVs, put up medications, take down medications. It was pretty good for me to see that. I was also able to do at my job. I had a patient who was on a G tube and a trach, and I had an order to cap her trach. And usually capping means we're putting like this little, in my facility we had like a little red cap, and we're closing her trach, and she's trying to breathe. Basically teaching her on how to breathe on her own without the machine and stuff like that. And we're usually monitoring the patients, her respirations, her breathing, everything. I believe it was every 15 minutes or every 30 minutes, depending what the family wanted, whatever they agree with the doctor. I remember that. I don't remember so much that order, and we were doing it for a trial of a couple hours a day. So that day we did it, I believe, for 2 hours to see how she was doing. She was doing pretty well. We were listening to her breathing, her lungs, checking her respirations, checking her oxygen level, little pulse ox and stuff. And yeah, that was pretty good. Something that I didn't know about, and I learned that day and stuff. Um, yeah, so I was pretty excited to be in the subacute unit, and it's very fast going. A lot of these patients have just came from the hospital, and they're here temporarily, and you're helping them, get better so they can go home and stuff. Some of them, I remember taking care of a guy that Saturday, and he was working from our place. So basically you couldn't bother him during the week, only for medications, but for anything else, like he would have his door shut, because he was working from, I think, 8 o'clock in the morning to 12 o'clock in the afternoon and stuff, and those were his office hours while he was there. So yeah, you meet a lot of people, and you come across people who, basically have regular lives, and they can't just stop what they're doing because they have a medical condition and stuff like that. So it was interesting to see that and even speak to these people, because the unit that I work at, a lot of people have behavioral problems, have dementia, are very confused. So I can have a conversation with them right now about, hi, my name is Blanca, I'm married with kids, and then 2 minutes later they'll come to me and be like, who are you? And what's your name? And where are you from? Oh, you're my nurse? You know what I'm saying? So I get that a lot on the floor that I work at. But the subacute floor, it was more like people like us who are learn oriented. They know exactly why they're there. Uh, they have family who come to visit them. It was just pretty good to see that different side and stuff like that. The only problem with patients who are learn oriented, some of them are more demanding, like, I need water, I need ice, or can you give me medications at this time? It was just like chaotic. And so basically what I did when I first walked into the rehab floor that morning, I went to every patient's room, and that's one thing that you do as a nurse. You check to see if your patients are fine, are alive, do they need anything. You do your rounds in the morning before you go count with the next nurse. And I went to every room in the morning, and I introduced myself, and I said, hi, my name is Blanca. I'll be your nurse for today. Please bear with me. Today's my first day on this floor. However, I've been a nurse on this facility for a couple years, although it's been months. But you say a couple years makes them feel at ease. I'm just here for today just to help out and stuff. But if you guys have any questions, feel free to touch the call light. Again, my name is Blanca, and I'll be your nurse for today. So that's my introduction in the morning, for any of the patients. But for rehab, this was my introduction because it was my first time on the floor, and I wanted to let them know that, hey, I'm new to this floor, so I'm going to be slow with your medications, but please bear with me. And just having that opening statement and coming to them, give them, they were happy about that. Like, wow, you came, you introduced yourself. Now I know that you're going to be a little bit late, but at least you're letting me know up front, because they're already used to their permanent nurse who comes there and gives them their medications on time and stuff like that. But it's good to speak to your patient and let them know how their day is going to go, and that you're this nurse, you're the new nurse on the floor and stuff like that. Not a brand new nurse, but you're the new nurse on that floor and stuff like that. You know? So they don't be so demanding and stuff like that. So yeah, it was a really good experience, like I said. And one thing that I did learn that another nurse told me after I finished that day on the subacute floor was, listen, don't ever have another nurse document for you. You document your own notes, because you're the one who's giving medications, and you're the one who's putting up those IVs. So you're the one who's seeing this patient like that. The other nurse, she's doing treatments, but she's not doing treatments on all the patients. When they put treatments don't mean that every patient has a treatment. Some patients don't even have treatments. Like, treatments mean like turning a patient every 2 hours, changing their wounds. What else? Checking to see if their spirals are up and stuff. Checking to see that their bilateral floor mats are in place. That's what they call treatments. That's what they put on the tar and stuff. So yeah, the nurse was saying, one of the nurses was like, how can she document on what medications, what pain medications she gave when you were the one on the floor giving those medications and stuff, and you were the one interacting with the patients? And I was like, that makes sense. And I remember at the end of our shift, the nurse who was doing the treatment, she was asking me, Blanca, who you give pain medication to? And was it effective? And I was like, yeah, but I didn't know why she was asking me that. And now I know, because she was putting that on the documentation and stuff like that. So now I know that in the future, when I go to run a floor and I'm the nurse on the floor and I'm working with another nurse and she's doing the treatments, then I'll be doing the documentation. Yeah, it's more work because you're giving meds and you're doing the documentation, but hey, you're the one who personally was with those patients. So why would you know what I'm saying? Why wouldn't you document on that? Sorry, that's my daughter in the background playing with my son. So yeah, that was pretty good for me. I learned that. And then I went back to my floor for one day, and then the following day they put me on another floor, which is also partial subacute and partial long term. And there I was able to hang IVs as well and stuff, and it was just a good experience for myself. I'm back, but then anyways, I'm back to my unit, and that's it for now. And so I guess my job is looking into putting me more in rehab so I can learn more. I know that I spoke to my ADON about it the other day, and she was like, yeah, I want to see how you will do if we continue to throw you there, because it is harder. You have to think on your toes. These people can be fine 1 minute, and then the next minute they can be going into a code and stuff like that. So that's why we try not to put a lot of nurses who are inexperienced in that unit. But especially somebody who's like you, who wants to learn, yeah, we'll do that. But we have to put a second nurse back there to help you out, just to navigate you and stuff like that. And I'm open for that. So yeah, my advice to you nurses, or to my future nurses, is definitely look into subacute. You will learn more. That builds up your resume, and it also builds up your experience and stuff like that. That's what I want to do. I want to eventually just work in subacute, because you guys know that I want to work in the ER and take it even to better, to bigger things like in surgery and stuff like that. But the only way you're gonna learn stuff like that is by you putting yourself in these tough situations, these critical care situations where you have to critically think and stuff like that. And as nurses, that's what you want to do. You always want to challenge yourself so you can be better in what you do. Um, I've seen a lot of things in these past 6 months, and I've learned a lot of things. I've done mistakes and I've learned from my mistakes, but it hasn't kept me like scared of doing, like pushing myself. I continue to push myself to the limit. And there's times, I'm not gonna lie to you guys, that I ask to be put in tough situations, and I'm not gonna lie to you guys, I'd be so scared. I'd be like, why do I do this to myself? I don't know what is gonna be the outcome. But can I say this to you guys? You can't determine the outcome when it comes to nursing. You really can. You're dealing with somebody's life, okay? And if you want to do something bigger and better, you want to put yourself in those situations where you can't think about the outcome of somebody. You know what I'm saying? Only that person up there is in control. And what I do every morning is I pray to him, and I leave it up to him, and I let him know, although I'm on the floor, make it feel like you're on the floor, and then you take over of what's going on. You know what I'm saying? Um, I don't like to preach faith on anybody, because everybody has different faith. I have a lot of faith in God, and it makes my day when somebody comes to me and tells me, "Wow, you were great," or "My experience here with you as being a nurse was great." I've had a couple patients come to me and told me that, out of patient's family member came to me one day not so long ago and was like, listen, you're an angel. Like, I don't know what you're doing here, but you're doing a miracle, and I just want to say that you're an angel to me. And I said, wow, that for me touched my heart, you know what I'm saying? Because I want to make sure that when people leave their family members in my hands, that they have peace in their mind when they go home, that this person's being taken care of, you know? And although I'm not going to be at this job for years for years and years, I know that I serve my purpose wherever I'm at, you know? So besides that, um, I want to continue to grow, and I hope that you guys see these videos and get and learn more from these videos and stuff like that, and be a thrill seeker of always looking and looking and looking around, you know, because nursing is all about pushing yourself to the limit. Well, really it is, you know, because how I always say, you can't determine the outcome, and this video is all about that. You can't determine what's going to be, what can happen, especially on a day-to-day, minutes, seconds of somebody's life and stuff like that. You see a lot of crazy stuff and stuff, but you also see a lot of good stuff in the nursing world. Besides that, I hope that you guys continue to enjoy these videos. I want to keep it as short as possible. Yeah, one more thing. Forgot to say, I always, you know, you always work hard, but also try to make time for your family. Like, we just went to Philly, had a good time. You know, I had the weekend off, so my husband and I and our baby went to Philly, and we did some historical touring and stuff like that and enjoyed ourselves. Like, you work hard, but you also want to make sure that you enjoy yourselves and stuff like that. And sometimes you have to disconnect from the world, you know what I'm saying, and do stuff that makes you happy. And it's me spending time with my husband and my daughter and my children makes me so happy and stuff. And sometimes I need that, because us nurses, even doctors, like, we will go mentally crazy. There's times where I have to go to my car and cry, or I just need to go to the bathroom and just give me a couple minutes, because I just need peace around me. And you guys will know that when you guys become nurses and you guys are working on that floor and everybody's looking for you because they need you, because you're the nurse on the floor. There's no doctor on the floor. Trust me, you sometimes need a couple minutes to be like, yo, please, this world needs to stop for a second, because I need to think. Okay? So anyways, thank you for watching me. For the ones who have passed the NCLEX, congratulations. Welcome to the nursing world. You guys are officially nurses. And for the ones who are going to take this NCLEX, don't be afraid, because you've been in school for this long. You're going to pass it. Trust me, you are. Okay? Thank you so much, and enjoy your day. Bye.